main concern of WHO now is what I have mentioned about measles and pertussis that is right here with us at the moment. I think for media to be mindful that during the COVID-19, there was this immunity cap. The concentration was on COVID-19, leaving the routine immunization, sort of neglected. The immunity cap is getting wider and wider on routine immunization. Plus, after the pandemic, the tourists travel plan and they're traveling from places where the outbreak of measles, so it poses a risk on other countries and with the traveling. I think right now the main concern of WHO regional office and Papatuna can make a comments on that is addressing the emergency issue or the current issue that we are facing now with measles and whooping cough that is escalating at the moment. But of all of these, vaccines, immunization is the answer. There has been a nationwide protective immunization campaign that is going on now on the routine immunization. There's also a vaccination campaign right now. But I think I'll give the floor to Papatunde to make a comments I think it's important for media to understand about the situation of measles and pertussis here in the Philippines and in the region.
Let's just get a roving microphone. There we go. Over to you, Babatunde.
Thank you very much, and thanks to Mr. Mendoza for the question. So, in terms of where are we now with COVID-19, we are in the situation is COVID-19, of course, as you're aware, is let's say stabilized globally in terms of the number of cases. We are not seeing any surges in terms of number of cases of COVID-19. And so this is to be commended. But having said that, of course, our current reliance is on laboratory confirmed cases, as there are very few cases now being individually identified using what we used to call RATs, or rapid antigen tests. Now, in relation to this, previously for 3 years, the world focused on COVID-19. And at that time, as has been said by the regional director, the immunity or protection in relation to other diseases that were vaccine preventable suffered because the vaccine uptake in many parts of the world decreased. Now, we are seeing, as a result of this, some of these outbreaks of measles and pertussis around the world, and therefore our aim is to use the lessons from COVID-19 to help us to strengthen our health systems and the health system infrastructure in order to be able to respond appropriately to these actual emergencies. And as you also may be aware, when we talk about COVID-19, you may be aware of the pandemic agreement, which is being discussed in Geneva at this time. And this will also help to prepare the world against future pandemics, such as the one that we have seen in relation to COVID-19. I can answer further questions if you need clarity, but I think maybe in the interest of time, back to Liv.
Thank you both so much. Dr. Rui, did you want to add anything further on that, on the situation in the Philippines? We'll get a microphone to you as well.
Thank you very much. So, Lee, you want me to also add on the COVID or go straight to the measles and pertussis? Okay, I think I will start my comment with general comment on COVID as well. I think you mentioned, our journalist mentioned about the lifting of COVID being public health emergency of international concern. That's true. But please bear in mind, we do not leave the preventive measures. So preventive measures still there with you. Now, the second point about COVID is that we have conducted what we call after-action review, with not only from health sector, but also involve other sectors. And we have, I think, a lot of lessons that we learned. And then as a follow-up of it, I think, WHO country office, in collaboration with regional office, we try our best with the Department of Health to improve the preparedness, including some what we call simulation exercise at the airport. And now we start the simulation exercise at the subnational level. So that's just for your information. Now, I think you're very much interested to know about the situation of measles and pertussis in the Philippines. I think I think it was published in the media a few weeks back about the measles, particularly in BAM. RD has mentioned that this is, among other things, is the result of probably the restriction of movement during COVID-19, which created a gap of the immunization in the Philippines. Now, I just want to go directly to the response to this. Last week, I accompanied Honorable Secretary of Health of Philippines. We visited BAM. Basically, that was to look at the preparation at the BAM. So we met with, of course, the Chief Minister and high-level officers from the Ministry of Health in BAM, and also we met with some community leaders to look at the preparedness preparation for this campaign, which started 2-3 days back on 1st of April. As of today, let me look at my note here. Together with Ministry of Health and in collaboration with WHO and other partners, we are able to mobilize 4,579 vaccinators to cover all areas in BAM. And as of yesterday, we are able to vaccinate children from 6 months old to less than 10 years old. The number is 232,890, which represent 17% of the target population. The target population, I think, was informed earlier, about 1.3 million in BAM alone, right? So we continue to work with the Department of Health at the central level as well as at the subnational, including BAM and also municipality level. And at the national level, the Department of Health has activated Emergency Operations Center, of which WHO continue to be part of it. And we have the meeting every day to look at the current situation and also analyze the situation, including the challenges in the field. And we discuss with the authorities at the subnational level to address the challenges facing the situation in BAM. So that's about the measles in BAM.
I think it's also important to note that measles is one of the most contagious disease worldwide. And to avoid the large-scale recession in the region, we need two important things. High-quality immunization coverage. That means you need to have 2 doses of measles vaccine, as well as a strong surveillance system for early detection and response. And in the last few weeks, I have sent a letter to all the ministers within the region of Western Pacific, recommending to them the outbreak risk assessment that need to be done, and a high quality vaccination, and to strengthen the surveillance system and the capacity of countries for outbreak detection and response. We do expect the measles outbreaks to spread to our member state in the region. And I think this is very important. We've seen cases now in Vietnam, in Malaysia, Laos, PDR, and I think this is important for the region to be aware, raise awareness, and work on preparing and strengthen the health system if there's an outbreak of measles in their member state. And I don't know whether Ras want to add on to the important.
Yes, indeed, as Dr. Rui and our regional director have mentioned, this is a challenge for the whole region, not just Philippines. But yes, some countries have lower vaccination coverage rate, so they are at a higher risk, especially Philippines and Papua New Guinea, also a few other like Malaysia and Laos. So as regional director mentioned, we have sent out letters to all member states to ramp up the routine vaccination, but also wherever required to do catch-up campaigns. And at the same time, apart from this immunization, we have to strengthen the surveillance and response systems to diagnose these outbreaks early through epidemiological and laboratory investigation so that we can take rapid action to prevent further spread. So immunization and surveillance and response, both are important. Thank you.
Thanks so much, everyone. I see another question here in the room. Let's bring the microphone over. If you could just kindly introduce yourself as well.
Hi, Liv. Dr. Sai, I'm Rafael Bosano from ABS-CBN News. So given the immunization gap caused by the pandemic, when do you see countries actually bouncing back and recovering the immunization rates back to normal levels during pre-pandemic times? And how big of a threat is this, or how big of a pressure is this on the health system of these countries?
Thank you. I think we have advised all member states, to strengthen the routine immunization, not only for measles, but all routine immunization that were neglected during the COVID pandemic. So there are 8 countries in the region that have declared measles, rubella elimination status. But it doesn't mean that they don't have the risk. They still have the risk if you don't have the 2 doses. Secondly, because of the traveling of travelers now from places that they have the outbreak now. And I think that is important. It's just to encourage all member states to strengthen their immunization. Now we are seeing pertussis here. Like what I said, it's not only for the measles, but other routine immunization. So the pertussis will also spread as well. So very important. Russ, do you want to add on a comment on?
Yes, unfortunately, we have more than 1 million children who have 0 dose of vaccines, any vaccines. So that's really unfortunate because vaccines work on the principle of herd immunity. And for highly transmissible diseases like measles, if we don't have 95% immunization coverage rates, then some of these people, some of these children, like 10%, 20% are unimmunized, as is the case in many countries, then everybody is at risk because those who are partially immunized will also be affected. So it is unfortunate that some of the countries like Philippines, for example, they are among the top 5 countries of the world for 0 dose children. So we have to ramp up routine vaccination plus do outreach campaigns to bridge the immunization coverage gap.
Thanks so much, Raphael. I can see we also have a question from Casey from Rappler. Go ahead, Casey.
Hi, I'm Casey from Rappler. Just wanted to ask, can you elaborate more on the challenges faced by Western Pacific countries in ramping up or strengthening their campaign for routine vaccinations? Is vaccine hesitancy a fact among these factors?
I think back to Raj. Sorry, I should have introduced Raj properly. This is Dr. Rajendra Yadav, who is in our Division for Disease Control. He's here today helping answer some of the questions. Some of you might remember him from when he was with the Philippines Country Office. Let's get the mic back to Raj if we can. Thanks.
Indeed, as I mentioned, ramping up the vaccination should be one of the top things that countries can do. During COVID-19, as Dr. Rui also mentioned, we had issues with the mobility of health workers, and efforts towards immunization has relaxed. So as I mentioned, huge number of zero-dose vaccinated children, but also partially vaccinated children. They are huge. Like 3.5 million children are partially vaccinated, and I said already more than 1 million are zero-dose vaccinated. So one of the best things that can be done is not wait for mothers or fathers to bring their children to the health facilities. So it should not be just a facility-based approach, but also we have to go out to the communities that we identify as the unreached, and then reach them with the outreach campaigns or outreach vaccination campaigns.
Thanks very much, Raj. Appreciate mothers and fathers' responsibility bringing their children to. Rui, also, do you want to add a few more remarks?
Thank you. I think the question is very pertinent. I think the approach to bring back the immunization coverage to the situation prior to COVID, I think it involves a lot of work in that. Number one, I think, as you know, we need to fight against those anti-vaccination. This is really big work that we need to do. Therefore, I think I would like to take this opportunity, RD, to urge media to play a role in that. I think your role in sharing the right information about immunization is really crucial. So that's number one. I think the number two is about the availability of vaccine. You know, vaccine is also, I think, something out there that you have to compete with other countries, and you need to find ways to make sure that you have the vaccines available to our children. That's number two. Number three is ensuring the quality of vaccines. That is also very, very important, particularly when we talk about the cold chain management. This is really important. And also we need to look at the policy at the country levels to ensure or that we can increase the coverage of the vaccination, and then the training of the health workers so that they are able to deliver, a safe vaccination program. So these are things that we need to look at, not only from one aspect, but many aspects involved. If all of us can work together, I think within 2-3 years, because it's not as easy as we say, hopefully we can go back to the expected coverage.
Yeah, on that note, and I just want to add on what Rui has said is very important. Media, you play a very important role. 1 million children in the region receive no vaccine at all, no vaccination at all, is alarming. And I think it is very important that media helps out in sharing the message, the importance of reaching out. Because if action are taken to reach every child with the vaccines and strengthen the health system, even those who had declared elimination, they still have risk of resurgence, and especially of this highly contagious. We believe that no child should get sick or die from measles. And that's the message that need to go out. Important to get your child the vaccine that they needed for measles. The 2 doses, and your child will be well or even better protected from the measles outbreak. Thank you.
Thank you so much, Dr. Piukala. Any other questions in the room or online? Over there. GMA News, go ahead.
My name is Ian Cruz from GMA News. A significant number of countries are now affected by El Nino. You can, of course, you can feel the scorching heat in the Philippines. And so what measures can you impart to the Philippines to mitigate the impact of dry spell in terms of health and disease prevention? Thank you.
Thank you so much for the question on El Nino and heat and the health impacts and what we can do. Let me introduce my colleague, Sally Edwards, here, who's our expert on health and the environment, who can give a few remarks to start with. Over to you, Sally.
Thank you very much, Liv. Good morning, everybody. As you rightly said, El Nino is affecting many of the countries in our region, but in very different ways. Different parts of the region are suffering drought and heat, and others flooding and extreme storms. What's very important is that our health systems continue to be prepared for all of these eventualities, all of the extreme weather events, that we really focus on strengthening our preparedness and readiness for these events. We're also working with countries to look at developing and strengthening early warning systems so that the preparedness can start to take place in an opportune time as we move through all of these different events, because El Nino, as a climatic phenomenon, does have these differential effects in different parts of the region, and the effects aren't only due to El Nino. We get flooding from all sorts of different causes. We get extreme heat related to and unrelated to El Nino, and so it's very important that our health systems are prepared and ready to address all of the different challenges that these climatic phenomena can produce.
Thank you so much, Sally. I think we are just about out of time unless there is one more question in the room, because we, as you may know, have a big event today to mark World Health Day with our key partners and ambassadors from around the world here in the Philippines. But just enough time if anyone here in the room or online wants one more question. Okay. I can see Ruel has a hand up, so we might have one. Yes.
So this one's from Pacific Island, from Islands Business News. Pacific Island nations such as Tonga have been found to have high prevalence in obesity among women and men aged 20 and above. What effective steps are being taken by WHO and relevant agencies doing to tackle this problem?
As in the remarks that I said about the Pacific Island countries, amongst the highest in the world, the top 10 in the world in terms of overweight, obesity, and NCDs related diseases. I don't think this is an easy fix. If that is an easy fix, we wouldn't be sitting here discussing it. But there has been, I think it's a multifactorial issues. It needs a whole of government, whole of society approaches. And unfortunate that most of the factors contributing to this is out of the control of those working health. Most of it are politicians. You talk about healthy choice should be easy choice. As you know, there are a lot of the processed food, unhealthy food are much cheaper than the healthy food, and the availability. People says that is part of their life buying this cheap stuff, but unhealthy. And if you go and look for healthy stuff, they are the most expensive and it's difficult to get. So there's a need of a whole of government, whole of society to work. There has already some action in place in the Pacific. And the work that has been done, there has been a lot of effort put into it. But the result that we expected, that we want to, is very slow. And I think our expert here on NCDs will make a comments, and not only for the Tonga, but for the whole Pacific Island countries.
Thank you, Regional Director. As you've so eloquently put, the drivers of obesity are extremely complex, multi-sectoral, and WHO uses its convening power in the Pacific to try and bring all of the different parts of government together to really try and address the different complex nature of the issue. In last September, the Pacific Health Ministers committed to actions to address obesity in children and young people, and we work also very closely in schools to try and address some of the behavioral parts of obesity from a very young age, to really bring the knowledge to our young people to give them the best start as they go forward in terms of knowledge.
Thank you so much, Sally. Thank you so much, Dr. Piakala. I think, okay, lucky, quick last one from Red before we finish up.
I have a follow-up question on the El Nino. Dr. De Jesus, do you have any specific advice for the Philippines regarding the El Nino phenomenon here in the Philippines, resolving the, of course, we have schools canceling classes because of the heat. What advice would you offer to the Philippine government in terms of the health issues arising from the El Nino phenomenon, especially in sanitation, water?
Over to you, Rui.
Thank you for the question. Yes, I think as you rightly pointed out, the impact of the El Nino towards the availability, or I mean the water and sanitation issue. The government shared the information with us, or the information that we access. There is an increase of numbers of food and waterborne diseases, right? So therefore, in many regions in the Philippines, we work with the central governments as well as with the LGUs to strengthen the surveillance system for the food and waterborne diseases. And also we supported some test kits to the local government to diagnose or to test the possible increase of waterborne diseases in particular. One practical thing that we are working with the government and as well as the local government is to improve or to strengthen the water and sanitation system in healthcare facilities. We conducted, in fact, a small study which shows that there is a need to strengthen the water and sanitation in healthcare facilities. So that's what we've been doing. Thank you.
Thank you so much, everyone. I'm sorry that we're out of time, but for any journalists who have questions for us still, either here physically or online, please be in touch. My team will be happy to help respond to any of those. Thank you, everyone, for joining us. Thank you, Dr. Piakala, our WHO representative and our directors here in the room, colleagues and friends from the media and online. Please also join us for the World Health Day event that I mentioned, which is starting in about half an hour, which will be live streamed on our channels as well. And please do join us in, marking World Health Day and calling for the right to health to be fully realised for all of the people living in this region and beyond. Thank you very much.
Thank you.